Nurses, what are the most haunting last words patients have said to you? Story 1. Not the very last words, but I found them quite unsettling. A few years ago, my best friend lost her fight with cancer. Her mother had also passed away of cancer when my friend was 21. I helped care for my friend right to the end so she could be home instead of in hospital or hospice, and I was there when she passed. About an hour or two before that, she started getting very agitated and asking for some very specific things. Some buttons of a certain color, a particular item of clothing, a few other things as well. Her sister realized that she was asking for things that her mother had been wearing or had in the room when she passed, and got very upset and told her that she didn't need them. It was okay without them. My friend looked at her and said, "Don't worry, Mom's telling me how to pass away." She was seeing her long-deceased mother and thought she needed the same setting before she could pass. I assumed that it was a hallucination. She'd been having them for a couple of days at that point after her pain meds were increased, but it was very unnerving to witness and seemed different to the other hallucinations she'd been having. Maybe she really did see her mother. That moment certainly brought me closer to believing there might be an afterlife than religion ever did. Story 2. I worked as a CNA in a nursing home for 2 years when I was in nursing school. We had patients in hospice frequently. Most of them at the end just peacefully slipped away. We had one gentleman who was always just, if he wasn't trying to grab my behind, he was yelling at me over something I couldn't help, like the lights in the hallway or his roommate snoring. He used to change his TV every time I came into his room so we could watch Shark Week and trashy reality shows. He got a bad diagnosis and went downhill really fast over the course of a week or so, and we called his family. They were on their way, but they wouldn't be there for a while, so I stayed with him the first night that we all kind of knew he didn't have much longer. He was panicking. He wouldn't settle down. He kept saying, "Help me," and there was nothing I could do. I just held his hand and told him over and over he wasn't alone. He was like that for 2 or 3 days before he slipped into a coma. It still breaks my heart. I think about him looking at me that way that he did and frantically asking for help, then telling me he loved me, then asking for help again. I wish there was something I could have done. I've seen death plenty of times, but I've never seen that before or since. I hope I never have to again. Story 3. Not a nurse, but we had a guy who was in a major MVA. His left arm was severed above the elbow, and he was circling the drain. His blood pressure was tanking, pulse was starting to fade, and he asked me about his dog that had been in the vehicle with him. Asked me if his dog was okay. I didn't really answer him, as the dog was passed away, and I didn't want to put him in any more distress than he already was in. We landed a helicopter, and I kid you not, we were about 30 seconds from loading him into the helicopter when he coded. If you know anything about traumatic CPRs, there's virtually no chance that they will survive, especially without deficits. Maybe like 1 to 2% chance, I can't remember the exact number. Anyway, we worked him, got him loaded back into the ambulance, and made the 35-minute plus transport to the trauma center through rush hour traffic. Got him into the trauma bay. The doctor said they were going to do one more round, and if there was no improvement, they were going to call it, which they did. So the last thing the guy said was, "Make sure my dogs are okay." Ultimately, he passed from internal hemorrhaging, which there's nothing we could really do in the pre-hospital setting for him. If we had TXA or something like that, we could have used it, but it's a toss-up whether it would have helped this guy at that point he was at. Story 4. Had an elderly woman who was intubated and sedated. When you have a patient who's sedated, you turn down their sedation and try to wake them up, kind of, every morning to test their readiness to come off the ventilator. She never really woke up. Her adult son was distraught. He was her next of kin, and he had to decide if he was going to take her off the ventilator or keep trying. He agreed to take her off the vent the next day. I was in her room later that day, and I was chatting with her like she could hear me, when suddenly she responded. She made a purposeful nod. I was startled, to say the least. I took her hand and tried to figure out how to explain to her what was happening. She was dying of cancer. She was failing her weans, and we planned to take her off the vent tomorrow to pass with her son by her side. And I asked, "Is that okay?" She nodded. "Do you want me to call your son and tell him that you love him?" She nodded. I wish I could remember what we talked about next. Did I pray with her? Did I comfort her? I don't remember. But I do remember calling her son and telling him that his mom knew she was ready and that she loved him. Story 5. When I was 19, I was working in a lab at a hospital as a phlebotomist, and I was really good at drawing blood. But I was called to the ER to draw blood from a 12-year-old at around 7 a.m. He had spiderweb-looking veins all over his body, except his hands, feet, and above the neck. Draw blood, no big deal. Called back again to draw a second sample. Everything was purple. He looked up at me and asked me if he could have some water. I looked at the attending and he shook his head no, and then mouthed, "We are about to intubate." He grabs my hand and 2 seconds later, he goes into arrest. His parents were outside the room looking through the glass. Mom was bawling. Dad was bawling. Everyone did chest compressions for what seemed like 45 minutes. He passed away. Last thing he said to anyone was to ask for some water. From me. I left, kept my composure, got to a private hallway, and started bawling the entire way back to our office. Walked into my boss's office and said, "I quit." Turns out the kid had bacterial meningitis. Story 6. After Dad graduated medical school, he was a resident in an inner-city emergency department. One night, rescue brought in a guy the department knew of, major health issues, major addiction issues, and a real scumbag to boot. When rescue found him, he'd been laying on his own filth for days. His chest x-ray was lit up like a Christmas tree, with pneumonia, as my dad tells it. His heart was in even worse shape. Even while laid up in bed, this guy still found time to harass the nurses, throw out every name in the book. Real nice dude. So my dad was at the nurse's station when he noticed an irregular rhythm on the guy's heart monitor. When Dad tells it, he likes to make a repeating M shape with his finger. He was going into ventricular tachycardia, not a great sign, so he headed over. My dad stood in the doorway and said, "Hey buddy, how do you feel?" And the guy looked at him in the face and yelled, "With my hands, you jerk off!" And then he passed away. Story 7. Not a human nurse, but I once worked as a vet's assistant. I hope it's okay that I'm writing this here. This memory still haunts me, and it's the reason why I changed jobs, because I couldn't bear it anymore. We needed to euthanize a very sick and old poodle. He was the poodle of a very old lady. She held my hand, cried, and asked me, "Why can't you euthanize me too? I have no one. My husband passed before me. My child passed before me, and now my dog. I have absolutely no one. I just want to pass away. Why can't I get euthanized too? I don't want to live anymore. Please." That's over 10 years ago, but it still makes me cry. And I know it's necessary to put animals to sleep when they're suffering and can't be saved, but it was too hard for me. I was an emotional mess after working in the vet practice. I can't even imagine working as a nurse, or working in a children's hospital. I'm too sensitive. Story 8. Actual nurse here. The superstition is that patients will feel a sense of impending doom when they're going to pass away. Sometimes everything looks great on paper, then they say, "I think I'm going to go." And then 12 hours later, they're lifeless. The first time this happened to me, it was at the end of a crazy 12-hour shift where my patient had gotten progressively worse, from mildly sick to unalive. When I walked on that evening, he looked me in the eye and told me he was passing away. He was just on a touch of blood pressure and dialysis support. We did all the scans, all the lab work, but nothing could explain why he was tanking so fast. And then right before he passed, 12 hours later, he grabbed my hand, looked me in the eye and said, "I told you so." Has happened a few other times, but that was the creepiest. Story 9. I have had several elderly patients tell me their long, unalive relative will be coming by to get them at a specific time. Every single patient that has told me that has passed at that exact same time the patient said they would. I've also learned to take note when a patient says he or she is going home tomorrow, especially when you know that patient isn't going home tomorrow. Saddest, my favorite patient I'd been seeing for years was in the end stages of liver failure. One morning, she didn't recognize me. This is a patient who knows me well. She knew my child's name and my dog's name. We have a very long history. I cried when I saw her labs. She passed very quickly, and all I could do was hold her husband's hand and pray for her. It was so sad. She was only 40 and had 2 young children. I see her husband every once in a while in town. He seems so sad every time I see him. Story 10. They weren't last words, but words spoken in a shocking, lucid moment. I was helping a patient in my rehab unit to bed. She had profound dementia and mostly babbled incoherent, nonsensical sentences. I just nodded and pretended to converse with her, which she enjoyed. This night, though, she stopped and abruptly looked at me and said sternly, "Tempus fugit. Remember that. It's important." I just grinned and laughed a bit and then got her to bed. I looked up the meaning later. It's always interesting to me that the most common thing my patients use their lucid moments for is to tell me things they want me most to know about life. Tempus fugit means time flies. Story 11. I was working in a pediatric cardiac intensive care unit, and we had just admitted a toddler from the ED. She had just beaten cancer, but wasn't feeling too great. They got an echo that showed severe cardiomyopathy, which was most likely from the chemo, which we caught too late. As we were tucking her into the CICU, the docs let her mom know how sick she was, and Mom started losing it. Mom was frantically calling her husband to come to the hospital ASAP. The toddler was still pretty with it to this point and asked her mom, "Mommy, why are you crying?" Her heart started giving out within the next hour, and she passed while we were trying to get her to bypass. Her mom's wails still haunt me to this day. Story 12. I don't remember what his exact last words were, nor am I a nurse, but I remember the most meaningful thing my grandfather did for me before he passed. He was suffering from a severe cancer all over his body, and he had refused treatment since it was already everywhere when they found it, and it was his third time getting cancer. So at his deathbed, he could barely open his eyes and couldn't speak. But one thing he could do as I cried and told him how much I loved him was squeeze my hand. It was his way of telling me he heard me and loved me too. I will never forget him as long as I live. I love you, Grandpa. Hope you're playing your guitar in heaven. Story 13. I've posted about this before. I worked as a home hospice RN for a couple of years. We had a couple on service, and they were the sweetest. We assumed the husband would pass first, but his wife actually went first. He deteriorated very, very quickly. He passed days later. Right before he took his last breath, the door to their house opened, and he said, "Come on in, dear." They loved each other so much. I'm not sure I believe in an afterlife, but I hope they're together. Story 14. My mom was sent home from the hospital because she was nearing the end and wanted to be home. The last few days, she was heavily medicated and didn't really communicate at all. On Sunday, she took off her oxygen mask and said she was going to pass tomorrow. She put her mask back on and didn't talk anymore. I called out of work, that was an odd call to make, and called the family. Her twin drove 4 hours to be there on Monday. She passed Monday evening with her whole family at her side. It's been 4 years and it still weirds me out. Story 15. Not a nurse, but I had a kid who was just standing on a sidewalk in a bad neighborhood, drive-by shooting, which of course missed their target and hit this kid and older gentleman. Older guy was dead on arrival, kid who got hit in the arm once and chest twice, barely clinging to life. Only thing we ever heard him say before he went unconscious was how much pain he was in and that he didn't want to go, which happened a few minutes later. I've never worked so hard on a PT before or since. Partner quit the next day, and I'm still going 13 years later. Story 16. Obligatory not a nurse, but my great-uncle's last words were about having to catch the train. My grandpa's last words were about getting on the ship. My dad's last words were about making his flight. I've told everyone I've ever dated to wake me up if I ever start talking in my sleep about transportation. Click on one of the videos you see on the screen now, or a Karen will sue you.